Okay, we're getting into the first official chapter of ICD-10-CM. Chapter 1, Certain Infectious and Parasitic Diseases. So we start with the letter A. We have A00, and we go through the letter B, B99. In terms of these chapter-specific PowerPoints and presentations, I'm really just focusing on the coding guidelines. You'll see I have additional videos for practicing how to code out of these sections. So there are a lot of additional things in these chapters that I do not cover. I just want to make sure that we talk about the guidelines, and you can kind of see how those are applied a little bit. Okay, so again, those of you familiar with ICD-9, probably the main thing you remember out of this chapter, the two main things are HIV guidelines and sepsis guidelines. So that's where we're going to spend the majority of our time. So the first is with HIV infection. We basically have two codes, Z21, asymptomatic human immunodeficiency virus infection status. So that essentially means HIV positive. So the patient is positive for the virus in their blood, but they don't have any symptoms of an HIV-related illness. And not only that, they have never had any symptoms. So essentially the way the code book looks at this is you're either HIV positive, meaning that the virus is in your system but it has not caused any issues, or you're HIV positive with the disease. So B20 or B20 is human immunodeficiency virus disease. So that means not only is the patient HIV positive, but they've had some sort of illness related to that virus. Okay, so basically patient is HIV positive, Z21, until they are symptomatic. At that point they're going to be a B20. That same patient is never going to then be able to use the code or be assigned to the code Z21. Okay, so let's take a look at these in our index. Oh, if I can tab correctly. So let's go to HIV. Let me see how hard it will be to get there. Oh, not too many occurrences. I think we can get down there fairly quick. Okay, so if we just look up HIV, notice it has C also, great example of our cross-reference, human immunodeficiency virus, and we have B20. Now we have a couple other subterms. We have laboratory evidence, or non-conclusive, and here's a non-conclusive test. That gives us R75. And then we have a positive or seropositive Z21. These are just referring to inconclusive or seropositive tests, not actually to the diagnosis of being HIV positive. So let's go to human immunodeficiency virus and see if we can get at least one other code that we can look at. So here we're at human immunodeficiency virus, HIV disease. We get that B20. Notice infection, it reads HIV disease. So this one is indicating that the patient actually does have some sort of illness related to that HIV. And then here, kind of again like where you initially start when you're just HIV positive, asymptomatic status, the Z21. Okay, so you do have to be kind of aware of the terminology there when you look this up. The patient's either going to be B20 or Z21. A patient's not going to have both of those codes on the same record. Oops, sorry. So in this one, positive HIV test in a patient who is asymptomatic, presents no related symptoms, and has no history of HIV infection. That's a Z21. So just HIV positive, but has no history of HIV infection or any sort of illness. Now, again, if they have some sort of related illness, let's say it's Kaposi sarcoma or thrush or something like that, then they're going to be a B20, and they never go back to code Z21. We also looked at that R75, inconclusive laboratory evidence of human immunodeficiency virus. So some guidelines here. We want to code only confirmed cases. So that's why the inconclusive, we're not going to code that as a Z21. Did I get that right? We're going to code it as an R75. The principal diagnosis is going to be based on circumstances of the admission. So patients admitted for an HIV-related illness, for example, agranulocytosis due to HIV infection. So here, the agranulocytosis is related to the HIV. So this patient cannot be assigned the code Z21 because they are symptomatic. So automatically they're a B20. So if they do have an HIV-related illness, your B20 is first, your HIV disease, and then you have an additional code for whatever illness that is. So in this case, we would have agranulocytosis as an additional code. So let's take a look at how we would code that. So we have our human immunodeficiency virus, we get the B20. We can look that up in our index. Human immunodeficiency virus disease. Notice here our excludes 1 if they're asymptomatic, if it's just an exposure, or if it's an inconclusive serologic test. We can't code the B20, we have to code something else. So we'll go with the B20, and then we had agranulocytosis. We'll get down there. We don't have any additional information, so we can just code the D70.9. Take a look at that in our index. So notice D70 neutropenia includes agranulocytosis. We don't have any. Actually, here I could see the argument for coding it as a 0.3 neutropenia due to an infection, since we're talking about an HIV infection. So I think you could warrant coding D70.3. So we'd have B20 and then that D70.3 to fully code this situation. If the patient comes in with an unrelated illness to HIV, so maybe, I don't know, they just fell down and broke their wrist or cut their finger or something like that, something that's not related to the HIV infection, that's actually going to be first. So again, think back to your principal diagnosis definition, the reason they came in, right? So they didn't come in for anything to do with HIV. They came in because of the broken finger or whatever we're looking at. But we're still going to have an HIV code in there because that's definitely going to have an effect on the patient's care. So here's an example. Acute appendicitis, admitted for appendectomy. So that's just clarifying that that really is the reason that they were admitted to the hospital. We also have a Kaposi sarcoma of the skin of chest due to HIV infection. So the first thing we're going to code is the acute appendicitis. So let's get up here. I know we already coded this one, but we'll do it again. So appendicitis, acute, and we don't really have any additional information. So we get the K35.80. Whoops. We'll just take a look at that real quick. So again, that unspecified acute appendicitis. And then we have Kaposi sarcoma of skin of chest. So let's take a look at that. I'm just going to type in Kaposi's and see if we can get there. Let's see if we can find Kaposi's. Here we go. Here's Kaposi's sarcoma, and then we have skin, and we don't get quite specific to chest, but let's take a look at C46.0. And here we have Kaposi sarcoma of skin. Notice under the category code first any HIV disease, the B20. Okay? So we've got the C46.0, and then due to the HIV infection. So here we would actually code the appendicitis first. I apologize, I don't remember what that code was. Then we would code the B20 for the HIV infection. Then we would code the Kaposi sarcoma, which is a C46.0 of the skin. Pregnancy with AIDS. Pregnancy always has special rules. Just kind of FYI, pregnancy codes always take priority over every other chapter. So your pregnancy code is going to be first, so you get this 098.7, and let's take a look at that real quick. Here we go. So HIV disease complicating pregnancy, childbirth, and the puerperium. And then notice use additional code to identify the type of HIV disease. So you get your O code, your HIV code, and then assuming that it is symptomatic, then you would have what any of your AIDS-related illnesses, so your Kaposi sarcoma or anything else you have going on. If they're just coming in for testing for HIV, there's a couple Z codes, Z11.4 for screening, Z71.7 is for counseling. Alright, so that was kind of the whole HIV section. So the main points there are just to watch your sequencing and again to note that difference between the asymptomatic HIV status and actual HIV disease. Alright, infections come out of this chapter. So with infections, you want to capture, if you know it, the causative organism. Now there are a lot that have combination codes, but sometimes they don't have combination codes and we have to use an additional code. So let's go ahead and just try out this acute empyema due to group B streptococcal infection. So let's check out the empyema first. Alright, and so here we have empyema, and you can see several subterms, but there is not any subterm that specifies streptococcal. Right? So we have due to group B streptococcal. We do have acute in here as a non-essential modifier. So we get the J86.9. I need to write these down as I go. J86.9. And let's take a look at that in our tabular. So pyrothorax without fistula, and it does have empyema in there, but it does not say anything about it being due to streptococcus. So here, kind of an FYI, your main term, if we tried to just look up streptococcus or streptococcal infection, if I can spell, even if we get all the way down to the S's here, oh, it actually will give it to you. So you can either go under infection or you can just go straight under streptococcus. Notice it says see also condition. And then here we know that we have group B streptococcal infection. So, and it's a cause of another disease. In this case, it's the acute empyema. So we get the B95.1. So let's take a look at that. So here's streptococcus group B as the cause of diseases classified elsewhere. So, and note here out of this whole B95 to B97 categories section, provided for use as supplementary or additional codes to identify the infectious agents. So these should not be coded by themselves. Okay? Notice that it reads streptococcus in diseases classified elsewhere. So you want whatever your actual disease is listed first. This is just a supplementary code to say, hey, we've identified that the bacteria is indeed group B streptococcus. Another way that you could get there, if you can't find it under the actual organism, is to go infection, and then you could go down to staphylococcal or streptococcal from there. B96 category gets at other bacterial agents, and then B97 is for viral agents.